this.
Hello, my name is Malia Jones, and I will be giving a speech on the opioid epidemic in Ohio. No parent wants to open their door to a handful of grim police officers delivering bad news. Accidental drug overdose causes thousands of premature deaths each year. And these deaths not only affect the families and friends of those involved, but also the town, the state, and the nation. An estimated 8 people die each day in Ohio to opioid overdose, and 115 people across the United States. In comparing the national average to the Ohio average is alarmingly high and increasing, and the need for finding solutions is crucial. According to Franklin County Mental Health, the leading cause of accidental death in Ohio is opioid overdose. In 2013, a study was conducted, and it reported that 2 million people fit the criteria for opioid abuse and addiction. The earliest records of opium use date back to the Sumerians in 3400 BC Mesopotamia, where they cultivated poppies, and opioids reached America in 1775. Frederick William Adams Serturner was the creator of morphine, and morphine was used throughout the Civil War to treat pain, and it caused over 400,000 soldiers to become addicted to morphine, which was called soldier's disease. By the end of the 19th century, Bayer Company had developed heroin and was selling the pills as less addictive cough suppressants. These over-the-counter sales led to an increase in opium addiction, and most addicts today began with prescribed opioids. According to many, the U.S. war on drugs began in 1909 with the Opium Exclusion Act, soon followed by the Harrison Narcotics Act and the Heroin Act of 1924. These acts tried to limit the usage of opiates because of the developing dependence. In the mid-1900s, opium was only given to dying patients with acute illnesses only, and opiophobia soon followed. It was the fear of prescribing opiates, and it swelled in the late 1900s, but was short-lived because of the need for opioid pain management. In recent years, the overdose record reached an all-time high of 52,404 people. Neonatal abstinence syndrome is when babies are exposed to drugs before birth, and they are born and have to experience withdrawal. In 2016, over 27,000 babies across the United States were born with this symptom, and 744 of those babies were in central Ohio alone. Using opioids during pregnancy can also result in other severe complications, including prematurity and stillbirth. Opioid abuse also poses a great economic burden on the United States, and is broken down into 3 general categories, including criminal justice, work productivity loss, and healthcare. A study was completed in both 2009 and 2013. In the criminal justice system in 2009, $5.1 billion were lost to opioid abuse, and it rose to $7.7 billion in 2013. Altogether, $55.7 billion were lost in 2009 and $57 billion in 2013. Naloxone, also called Narcan, was developed to reverse the effects of opioid overdoses. It blocks the effects of the drugs on the brain and also restores breath. This harmless and non-addictive drug saves lives and was created for the sole purpose of preventing overdose deaths. In order to combat opioid abuse in Ohio, my group discussed possible prevention plans including treating addiction as a disease, heavier jail sentences for drug suppliers, mental illness awareness, and free counseling for addicts and their families. Each member of our group ranked the 4 proposed plans on a scale of 1 to 4 in 7 categories, 1 being the best and 4 being the worst. These categories were then averaged out among the submitted grids and given a total score with a maximum of 28. The lowest scoring plans were considered to be the best. Together we decided that raising mental awareness and providing free counseling for addicts and their families were the best solutions. Using multiple forms of media, we proposed raising awareness about mental health, opiates, and addiction, and providing families with free counseling services. Those against the idea may argue that addicts won't want to admit that they have a drug abuse problem or seek help, and that cost of advertising would be too great, that more research is needed to determine cost effectiveness, the volunteers are hard to find, and that it won't cure the opioid epidemic. Not all addicts may be interested in counseling or resources, but for those who are, we need to advocate for them while also helping prevent others from becoming dependent on opiates. Advertising could be funded through fundraisers and nonprofit organizations, or simply by encouraging people to spread the word through social media platforms. Raising awareness may not end the opioid epidemic, but it will help prevent more people from dying. Increasing awareness throughout towns and organizations can also help Narcan become more readily available. For those trying to find help, organizations and counseling locations can also be more easily shared. Another benefit of raising mental illness awareness is educating the public, which will increase public approval towards finding better solutions. Cost effectiveness cannot be truly evaluated until the plans are tried, but free counseling and awareness will help reduce crime, healthcare costs, and more. Volunteers will not be hard to find because of the amount of people who already volunteer with organizations dedicated to saving people from opioid overdoses. You can do your part by spreading awareness about opioids and opioid abuse, as well as reporting substance abuse and encouraging addicts to seek help. Additional benefits include helping other forms of drug abuse through awareness, reducing economic costs, including on the criminal justice system, restoring workers' productivity, and reducing healthcare costs. With an average of 8 people dying in Ohio to accidental overdoses, these are the 2 best solutions. Through raising mental illness awareness and providing free counseling for their families, we can help these opiate abusers receive counseling and prevent others from becoming addicted in the first place. I challenge you to share just one piece of information about opioid abuse in Ohio, and to challenge your friends to do the same. By educating each other and preventing addiction before it starts, we can save countless families from receiving tragic news about their loved ones.